And when in around 25th of February, things were going up in Maharashtra, it was around 5,000 a day. It was possibly the time when India should have taken a very stern step and completely sealed the border of Maharashtra. They allowed it to happen. Again, I thought it was a bit of complacency. And then the vaccine approach was also very casual amongst the general citizen. Therefore, taking into consideration the complacency of the general population, the policymakers, the government, as well as a very casual approach in vaccination amongst the people, were responsible for this second peak. And the nasty thing that is happening across the country is something which we never thought would ever happen, considering the fact that India actually did fantastic during the first wave, bringing and keeping the mortality down to so less in a vast country of 137 crore. The second peak is really a nightmare. The government is trying their level best, but taking into consideration the suddenness to which it actually went up, it never had something like this. It went up straight up, almost perpendicular to the baseline. And before somebody could understand that there was a storm, and everybody was taken aback. And that possibly is one of the reasons. And the government also was caught wrong-footed. That's what I presume. And and the fact that there was a large amount of international travel allowed in the last 3 months. People were coming in, pouring in. People were holidaying in this country, and therefore it came up. The government started taking all the steps, but the suddenness was so intense that I thought they were caught wrong-footed. People have been fighting in the medicine shops to get oxygen cylinders and holding it up. So this is one of the major reasons, and therefore the government should have sort of charted and planned out a sort of a navigation map of real red zones, the orange and the green zones, and the distribution should have been right at the beginning in that way. I'm sure they are doing in that way, but the suddenness caught them wrong foot. The second important fact is, which we feel, is that there was indiscriminate use of remdesivir as a sort of matchstick reaction by many physicians. I mean, anybody who was having some sort of corona, they were getting admitted, and they were actually saturating the beds, and they were using remdesivir for no reasons. While we know that this is a drug which is being useful in only 10 to 20% of the people who are having severe disease, I mean moderate disease, and would rather not prevent mortality when it's a severe disease. But that drug was used in a random fashion, and that led to a scarcity of remdesivir. I mean, these are the two areas where things went wrong. The third area I thought went wrong, it was the vaccination. I mean, uh, people were so casual, and people had that conspiracy theory that something is going to be implanted in their brain by a chip by Bill Gates, that they would be tracked. And these insane ideas made many people feel that vaccine is not the appropriate thing to take. And now they are rushing, now they are lining up, and every vaccine center is becoming like a epicenter for creation of a super spreading of the epidemic. Rather, instead of hurrying to a lockdown, which will be a panic stricken reaction, they should force vaccination of people in every door to door approach.